your hips is that you're not hiking one hip, even space between your face. So you're literally just kind of feeling, and I can feel to my left through the back of the neck, so the cervical spine is lengthened, the shoulders are back and down, you're drawing your shoulder blades down into your back pockets, your abdomen is you're aware of it, your pelvic floor is up. And then this next one, bring the carriage into the stopper and bring yourself down to the arches of your feet. Your toes are still coming towards your shins. So you've got that contraction at the anterior aspect of your lower limb. Take an inhale breath, and as you exhale, you're pushing the carriage away, controlling the springs in. And the things that you want to say to your clients are controlling those springs. You've got a smooth motion, so there's no robotic type stopping and starting. It's continuous motion. Take one more, and then we're going to come on to the toes, and we're going to lift into that stiletto heel lift. We've still got that parallel position of our legs. Take an inhale breath, and as you exhale, push away, and then control in. Be mindful that the knees are still tracking over the second digit. You've got the contraction into the thighs and the hips. You're opening up through the hips as you extend the legs. You're keeping that nice neutral position. Shoulders are back and down, and the heels have remained lifted throughout this full thing. You're inhaling as you come in, exhaling as you go out, inhaling as you come in, exhaling as you go out. On your next out, stay out. We're going to go into tendon stretch, specifically Achilles tendon. We're going to go double under, so you go underneath now. If you are watching me, disregard what I'm doing with my right leg. I just can't stretch my right Achilles yet. So you're doing both heels under, then both heels up. Both heels under, both heels up. Your exhale is as the heels go under. Your inhale is as you come up into your calf. Exhale under, inhale up. Exhale under, inhale up. Now go into your pedaling of your feet. Now be mindful when you're pedaling that your hips remain level. So you're not allowing this motion more in that transverse plane, so that rotational movement of the pelvis. And we'll talk about our planes of motion. We'll recap on them after this masterclass. So you're thinking about, are my hips staying level? And you could ask your clients to put their hands on their hip bones and actually feel. And what you'll tend to find if they are moving is that one will sinking down. You'll have one that maybe becomes more prominent and one will drop down. What to do if you're finding that with your clients is get them to really just reset themselves, make their movement smaller, engage their core more. They're probably just letting everything wobble about and just no awareness. Then bend your knees, bring the carriage in and come right into the stopper. Shuffle yourself slightly down from the stopper. Now, from the shoulder rest, I should say, and you're right into the stopper. We're going to leave the springs as they are, and we're going to mentally set ourselves up for getting ready to go into our shoulder bridge, a movement you're all familiar with. Now, the first thing that we want to do with our clients is to bring our shoulders down so that we've got space to lift. If they're hunched up into the shoulder rest, they will find that they will end up leaving with a sore neck. Things will just not feel good. Next thing, contraindicated to have your headrest up for this move. So you can see with your headrest, you've got your little hinge joint. If it was up, this would be this. You're essentially a big fat fail, right? You're putting your client under a lot of pressure for their neck. So that absolutely must be down for anything where you're lifting the bum up. So just think to yourself, anything where I'm going to lift the bum up and put more loads through the upper back into the cervical spine, this needs to be flat. Now, legs, again, hip width apart, just as we did previous. You're lighting everything up. You've got a nice natural curve of your spine. Your shoulders are back and down. You're drawing your shoulders into your back pockets. You're taking an inhale breath, and as you exhale, you tilt the pelvis and you slowly lift yourself up. Now, what part of the feet are on the bar? Find what works for you in terms of textbook. Around the heels is meant to be easier and around the feet is meant to be harder. But I want you today to experiment with that, and you'll notice that your clients will do lots of weird and wonderful, funky things. Clients, now talk to me here for the Pilates teachers who are already teaching. What issues do they have with this move in your mat work? What happens to them? There's no wrong answer here. What do you find clients moan about? Hip maybe go too high, or they're just totally all over the place. What else, Mila? Come on, I know you've got something. What do clients do? What do they moan about with this movement? Hammies definitely get you a cramp, don't they? Hammies are a biggie. Yeah. Okay. So let's stop and think about this. So see, when you're doing this, are you feeling your hamstrings? Not really good, but good. Your clients will find that their hamstrings will just go into this like spasm, and see if you essentially, if they do, get them out of that right away, because if you push them past that, that will annoy them the rest of the day, if not the next day, right? Because it becomes something that takes a while to go away. The reason they're getting that is they're not activating their core and their glutes. They're all hamstrings. So what do we do? How do we rectify that? How do we get them in their body a little bit more to get them to be more aware of, how did I get this in my butt? I want to feel pain in my butt, not all hammies. So let's feel this. So if we lie down, right, and you've got somebody that's saying, oh, this is all hamstrings. So what I would say to you is really remind them about pelvic floor and core, right? Get your core engaged. And it sounds really bizarre, right? But I almost say things like, imagine you've got a fiver between your butt cheeks and you want to keep it there. Yeah? Only a fiver today, Camilla. We're not worth any more than a fit. Well, how much does it need to be? 20 quid. So you've got 20 quid between your butt cheeks and you're keeping that there. And it's almost what you're encouraging them to do is wrap around the hip, right? You're getting the glutes engaged. But I don't want that to be like an absolute, like 100% contraction, right? It's just this, you're bringing awareness to the glutes. Does that make sense? So take an inhale breath, and as you exhale, keeping your 20 quid in place, yeah? And it will feel different for them. So it's that encouragement of engagement of the core and the glutes. Now, just use, sometimes if we go too technical, right? So if I was being technical with that, right, what I would be saying to them is, I want you to rotate your femur in the acetabulum, right, and internal rotate your femur. Now, come on. Your clients are not going to have a clue what you're on about, and you're probably lying down there going, what way is internal, what way is external, where do I go with that? So when we think about the hip, and this is sometimes a lot of Pilates teachers get really, really confused about internal rotation at the hip joint when you're teaching, because you think internal, and most of you immediately go to what the feet are doing, because you think, oh, that must be external rotation, and that must be internal rotation. Stop caring about what the feet are doing. Think about what's happening into the hip. So think about your femur bone, head of femur into the socket. So if we think about a rotation, right, up here, think about that bone rotating. What way is that bone rotating? Okay, what way is that bone rotating? So this is actually external at the hip, and this is actually internal at the hip. So even though you'd be thinking, oh, my foot's going out, that must be exit. Okay, so if it helps you just think the opposite of where my feet are going, if that helps you get it in your head, yeah. But it's quite an important one. So see, when you're going down there and you're doing things like your footwork and your shoulder bridge, they should be in a slight internal rotation. So that will mean that it might look like the feet are slightly out, but really this bit isn't really our concern, but you're there. And what you should find is that you get this femoral rotation, right? That you start using that sort of terms in your class, you've lost them. They don't know what you're on about. So you need to just think about sometimes just having that squeeze your 20 quid and turn slightly out to the side. Okay, well, we'll help them. So keep it, you can say technical, but always have the lay term there as well. Does that make sense? So what is it, just clear that up, because it's always something that I see with teachers that they kind of mix that up. Right. So shoulder bridge. Let's get ready for your 100. So we need to change our springs for our 100, because right now we've got a heavy spring on. Now you could, in terms of teaching the shoulder bridge, you could reduce those springs down. I'm not going to talk to you today, but if we reduce those springs down, it makes it harder because you've got less support. So you can make your class or your one-to-one or your rehab much more difficult by reducing those springs down with your shoulder bridge position there. And we'll go into detail on this. it's definitely much easier if the more springs you've got. So if you get somebody that's really struggling, get all their springs on and it'll give them more stability. And if they're really, really struggling, just put them on the floor if possible. If not, just, I mean, if they're really struggling at that, they probably shouldn't be in a group class, let's face it. Right, there's probably more in the semi-private or one-to-one. Right, you want to leave a yellow and a red on, roughly. That isn't an exact science, and we'll talk about spring science today as well. So then you want to pick up your straps. You see mine has jumped off because it's tight. And then lie yourself down, and we want to find this lovely neutral position that most of us have no clue what that actually means, or how to get our clients in it, or what does it matter. Right. So 100 is your heat builder. We have done this is our third move, right, in the class, and we're doing the 100 already. Your 100 in your classical format will always be early on. It's your heat builder, it's your warm-up, it's a biggie. You want to have your hands in the small straps, generally small straps for the hands, big straps for the feet. Again, that isn't an exact science. The world is not going to end if you do it the other way around, right? It just means you've got a wee bit more leverage. So if you had a client that had shoulder issues or they want to reduce the tension, you could put them into the long straps, right? There's nothing wrong with that. And I'd rather to see you adapting that way. Now, we're going to think about our pelvic position. So tilt your pelvis so that your lower back goes down into the mat, and then tilt it the other way. And just feel the mat beneath your spine. Feel where your spine is this morning. Don't judge your spine where it was yesterday or what expectation you have entered with. Just feel what it needs today. As you're moving through that pelvic tilt, moving one way or the other, and remember, some of your clients will not know what a pelvic tilt is. So just by giving them that, bring your spine so you're squishing it down to the mat, so you're bringing it down there, and then now create a big tunnel under there. And sorry, John, for saying this, but it's usually the men that need that sort of description. They are not used to that sort of kind of motion and movement, right? So really look and use different language if you see that somebody's struggling. Now, you're going to find that place between both, so where your hip bones and your pubic bone are parallel, or you've got this natural curve of your spine. Now, if that's really making your brain hurt, basically just go to one extreme, go to the other extreme, and find that middle ground. Now, if I had somebody who was really struggling to keep that control, especially with beginners, I put them into imprint. I have them with their back down. And the reason I do that is because they can then feel if their back comes off, and they can feel if they're loading up in their back and not their core. Okay. But ideally, we want them in neutral, right? But we don't live in an ideal world. So float your right leg up, float your left leg up, put your hands into the straps. You're taking an inhale breath. As you exhale, draw down through your shoulders with the arms. Curl up if you're curling up, and you're breathing in. 2, 3, 4, 5. Breathing out. 2, 3, 4, 5. Options with the legs, they can be in that tabletop position. Where are your feet? Should they be plantar flex? Should they be dorsiflex? Do you know what? Vary that up in your class. What I will tell you is, from the general population, most of them struggle most with dorsiflexion. Dorsiflexion is something in all your classes and all your rehab work I can't encourage you enough to get your clients into, because most people are losing it. So if you're choose the dorsiflexion, because it will get that ankle joint motion that most people do lose. Right, you notice I'm not counting, I'm just kind of looking around the room. How are we doing? Okay, ease it down. You could be a counter in your classes if you want to be. I don't want to teach you to be a counter though, because a counter usually means you've got nothing useful to say, right? You're saying nothing apart from counting. It's fine to do it. Sometimes I will do it depending on what mood I'm in. Right? I'm not saying, oh my God, she's going to hear me counting and shout. I'm not. But I want you to really grow as a teacher and always think, how can I help people further? If you're counting, you're not a metronome, right? You're not really. It's a bit of a cop-out, isn't it? Right? Sometimes you need a bit of a cop-out, and that's okay. Sometimes in class, you're having one of those days, right? And you kind of just need to zone out and just almost just do it with them. You need your own mental health. But just know, try and give something. Try and have each person leave feeling that they've achieved something a wee bit further, that something's clicked a wee bit more. Try and give them something. So we'll go through when we break this down. Right, legs and straps, let's go. So this is your classic format. This would be, if you were in Joseph Pilates studio, this would be the format and the flow that you would do. Okay, this is the flow. And this can be super hard. There's no frills here. There's no props here. There's no balls. There's no bands. There's no sticks. We just got a reformer in us. Okay, first things first, we've got our legs in straps, we squeeze our legs together, our hips are level. So we want to make sure, again, what you will find is that people have lots of funky things going on in their body. You're going to look out for that. You want to make sure the hips are level, they're not hiking up, you're squeezing the thighs together. Now we plantar flex the toes here, people. We plantar flex them, so point them up to the ceiling, pointy, pointy, pointy toes. Pointy because it will help keep the straps on for no other reason, okay? Now, from here, we need to keep the sacrum down, so think about that flat ridge of your spine needs to stay down. Now, from there, take an inhale breath, and as you exhale, big circle. Just go for it. How big should the circles be? Oh. So bigger isn't always better, but it can be. Think big mobility, small stability, although both are working both. If your clients are all over the place with their hips, and we'll go through looking what we're looking for in these, if they are all over the place, make their circle smaller. How many repetitions? Somewhere between 6 and 12 is a good number for pretty much most exercises that you will do, apart from clearly the 100. How many sets of these things do you do? Well, that depends on the type of class that you're choosing to teach that day, and probably what mood you're in, and who's in your class, and how much you want to torture them. And then round the other way. And when we're designing our classes, we're thinking about moving our body in all planes of motion, especially our spine. So flexion, extension, lateral flexion, and rotation. We want to have that all in. So you can see right now we've done everything that we've done has been lying down. And then we'll go into the frogs. So yes, we're moving through this a little bit quicker, but we are master classing here. So we're exhaling as we go out, inhaling as we come in. Now, the big thing to notice with your clients with the legs, we want a 45-degree angle. Now, your clients will want to go lower with their legs for various reasons, so look out for that. Definitely a safety thing. If they go too low, and especially if they're over kind of probably about 5'8", what happens is they can end up lifting the end of the reformer up, right? So if they're taller, so it's really important that you don't allow your clients to take their legs down too low. And then from there, let's see about short spine. So bring your legs together, parallel them off, shuffle your shoulders away from the shoulder rest, squeeze the legs together, take an inhale breath, the legs go down first, and then as you exhale, peel the spine up off, come up, only up into where your neck feels good. Then your knees to your head, stay high, take an inhale breath, and as you exhale, articulate your spine down from the top to the middle to the bottom. And then we're going to do that 3 more times. Shoot your legs out, take an inhale breath. As you exhale, peel the spine up, bend your knees to your head, close the carriage as you bend your knees. Inhale, and as you exhale, articulate the spine down. 2 more. Legs go out, that's your inhale breath. Exhale, lift that up, bend your knees to your head, take an inhale breath there. As you exhale, articulate your spine down. Lovely, Camila, really nice. Squeeze it out. We got 1 more. Take an inhale breath, exhale, up, lift it up, bend the knees, and this is called spine stretch. Ease that down, 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 and take your legs out of straps. Put your short boxes on, place your sticky mat on top, and let's get set up for our short box series. So short box series, this is where we go into our back bends, this is where our tree poses, side work. So let's have a think about where we're putting this box depending on our height. So if you're taller, you will want to put your box between the peg and the shoulder rest. If you're smaller, you will put it basically between the shoulder rest or at the shoulder rest. It is always up against the shoulder rest. Always get into the habit of teaching your clients to put the box on so that it's not crossing over the wood, because there will be things that you will do with them where you will want that to slide. If it's a tight fit, so you've got to be quite specific with it. Some machines that you might work on, you're not able to do that, so make sure that you familiarise yourself with the kit. Some boxes are wider than the reformer you're on, so you might not be able to do certain moves that you'd maybe planned. So just make sure that you're very familiar with what you're working with. All springs on, every single spring. You want your machine to be stable. Okay. Now, it will move. Always warn your clients that it's not, this is still moving. Sticky mat on, different studios and different reformers, they might not use these. I always recommend them because most people wear things like Lululemons and other stuff and they're slidey. So safety. Foot strap down the bottom, right? So you want to just double check that it's on properly, that, you know, the carabiners look safe. You're sitting on the box, and then you're going to put your feet into the straps. When you're teaching this to your clients, essentially you want to have the feet in. I would always have like just right on the dorsum aspect of the foot. So look where Jen is, where you all are, you're all used to using these. Very important here, we dorsiflex through the feet, so the toes are coming towards the shins, so you're bending up, and that really is safety. Right, your clients will do some weird stuff. See with this, hover about them, especially if you've got something that's a wee bit unsure, because this is, I don't know how many times I've picked people up from the well at the back, right? It can be, and when I've done it myself, it's highly embarrassing, especially if you've done it. I think I was demonstrating how not to do something and kind of went a bit far and fell in during a class, and had to be picked up out of it. I've also had to be cut out of a machine once because I got stuck in a spring. Stuff will happen. Don't panic. Just laugh it off. But there's usually somebody in your class, you'll get to know participants, wherever you're teaching, whatever you're doing, that there'll be some people where you'll just kind of take a big deep breath and think to yourself, do I even want to teach that move today? Okay. See if you ever think that. Generally, my rule is just don't teach it, right? Because it's usually when you're picking somebody up and you're dropping them off at the A&E department, right? So I can't stress enough the importance of that. Depending on foot length and things like where you put your heels, I always rest my heels on the gearbox on the metal bar. You don't need to. Your feet also don't need to be in contact with anything. They will be mid-air depending on what you're doing, right? Your clients will freak out with that because they feel safe when they've got their feet touching the wood. They're not going to be fully against that wood the full time. So box, your rule of thumb, this is your hard rule with this, is that there needs to be at least a hand width behind them, right? But if there wants to be more width, they can have more width. So you can have somebody forwards. When I'm doing back bends, I'm always a lot further forward. That will give your clients more back support. Some people will love that, some people won't. But as long as they've got a hand width, that is your textbook position. Again, make sure you're even on it. We're then going to, loads of variations here. We're not going to go into a full back bend right this second. What we're going to do is we're going to go into C-curve and then restack through the spine. So you take an inhale breath, then as you exhale, tuck the tailbone under, scoop the belly in and come down and hold. Then take an inhale breath. As you exhale, restack through the spine, come back up. Take an inhale breath. As you exhale, tuck the tailbone under, stacking, scooping the belly in, shoulders back and down. Take an inhale breath, and as you exhale, restack through the spine. Do that again. Now, usually what I'll say to clients, inhale, exhale down, is I'll say, go to your sweet spot. Okay? That point where the belly just has a wee, it lets you know it's there. Yes? And again, now we don't want to go beyond that. Go beyond your sweet spot and see what happens. Right? It's you're kind of out of it, aren't you? You're just hanging. You're in the hips. The hips are doing the work, right? So look out for that with your clients, right? They'll be like, you'll see the ones that look like they could stay there all day, right? Generally, what you will find is that those that have been doing things the longest will be the worst students. So just take a big deep breath as a teacher, choose your battles. But yeah, it's usually the ones that have done this for 10 years, and you're like, yeah, you've been doing it wrong for 10 years, but you don't see that to them. What's that? Oh yeah, totally. They're just hanging in their joints. They're just not, yeah. And it's always the ones that are doing it wrong. So you've got to choose your battles, right? Don't see that they've been doing it wrong for 10 years. I think they'd probably been punchy. But it's in your head, you know that that's what you want to say, but that's brilliant. You're doing really well. And then let's try that, just positive reinforcement. Give them the shit sandwich. Good, what they need to improve on, and then finish with good. Okay, always positive. So let's get into back bend. You ready? Let's see how it feels. If you feel comfortable, you don't have to. So you take an inhale breath, your arms are straight out. Okay. Exhale, you C-curve through the spine. So you've got flexion through the spine first. Then you get to that point where you have to get to the extension. Yeah. So you extend through the spine. You can then take the arms over. Bring the arms forward, tuck the chin, and then restack through the spine. So do you feel that point where you go from flexion to extension. That will be a point for your clients where they'll get confused, because you're saying to them, C curve through your spine, be in the abs. You then get to a point where the sacrum hits the mat. You could say that to your clients. You'll feel the flat, ridgy bit of your bum hitting. That's when you go into that extension. If you say sacrum, some people know what you mean, but most won't. So use both terms is always good. And then you take it from that flex position into the extended position. Don't do tons of them. Probably 4 is a good number. They probably not great to do tons. Let's go into your tree pose. Take your, I'm unfortunately banned from tree. Well, I can do it with my left leg. So, tree pose, put your left leg into your strap. Right leg out. Honestly, like disabled leg. And then from there, same position. Hold behind the thigh. Sit up. All your clients will want to be here and hunched. Sit yourself up, shoulders back and down. Dorsiflexion through the left ankle. You're kicking your leg quite vigorously 3 times. 1, 2, 3. Hold it up. Get right up into the leg. Flex the spine now and bring your head to the shin. Now notice how you want to lean to the side. Get your butt bones even, and then from there, lean back. Now, hold it there and stay head to shin. Feel that pull through the left hip, okay? Go further. Allow that traction to happen. It feels good. This feels lovely. Some clients won't want to go further than this. You've got the hamstring stretch and you've got the traction through the left hip. Walk yourself down. Now go into your back bend should you wish. Feel good? John's tuck the chin into the chest, walk the hands back up, and you're out of there. Try the other side. Now look out for, so as you do this, just go into it. Kick 3 times. The kick is specifically a neuro stretch. It's for your sciatic nerve. So it's that kick 3 times vigorously, so you're giving it that stretch. Walk the hands up, flex through the spine. Be in that. Don't rush past that point. That's a really juicy position. Go further. Dorsiflex through the right foot. Then walk your hands down the thighs. Extend through the spine. It's nice, isn't it? All right, you're all right? Shit your pants a little. Tuck your chin to your chest. And then release. Who felt themselves veering off to a side? Yeah, right. Okay. So it's a great find. So we find our little weaknesses or our tightnesses or imbalances. So the big thing to work on there is, like, don't shy away from those. Like, oh God, why am I veering over? We got stuff to work out too. You'll see your clients like veering off. So what you want to think about, see the leg that you've got up. You want to almost plant the butt. You want to be heavy into the hips. Just stay as stable as you can. It's not the end of the world if you squint though, right? So try, when you're teaching, and I'm not saying that you are like this, I'm not entirely sure what kind of teachers you are, but try and be encouraging of all movement. There is no wrong movement, right? Unless that person's really going to hurt themselves, that's their body and that's how they find that position. Our job is to make them feel good, to free their body up and encourage movement and strengthen them up. And it might never look beautiful, but that doesn't matter, right? That's not what we're aiming for. So they might never look like that beautiful ballerina, but they might be able to walk better and not have back pain, not have knee pain, hip pain. So don't look for perfection. Get that person moving and get them as moving as well as you can, right? But it might never be what we would like it to be. We're going to go into our side bends now. So if you sit, you're probably best sitting facing, so if you two face that way and you two face that way, so you're kind of going to have to like stare into each other's eyes there, right? Weird. Yeah. So when you're conducting a class, and the reason being just so you can see, right, it's a bit weird, like, Kimberly can't see. So the side, when you're teaching a class, you might choose to teach like that, and it's fine, but you just need to be aware of, it's their left side, your right side, I'm going to tell them to do stuff. So it's whether or not you can cope with that, like different people doing different things, because it does get quite a brain fart. So you want to put your foot that's closest to the foot bar into the strap. Okay. Then from there, you've got a couple of choices. So the key here is that the hips are parallel, right? So you want to have the hips in line. So think about your hip bones being in line, and you're trying not to rotate whatever hip's on top. You're trying not to rotate it back, right? Think about that spinal position that you're then in, okay? So that might mean that you need to do something different with this. Now, in an ideal world, we'd be up in our half Z sit. Some of your clients are not going to be able to do that, right? I can do it with this leg, that leg, forget it. So here, I don't like this. We'll give it a go, right? Whose butt cheeks off? Okay, some people's will be, right? It's okay if it is. We're thinking about positioning. But what you want to look out for is that, right? And then that's going to be, you're going to make them, they're going to be hobbling out your class, right? You don't want that. Arms up, lengthen through the spine. Now here, where do you want to go? You want to be like this, don't you? It's like, oh, right? That's where your natural clients will want to go up, get them up, almost get them visualizing they're being pulled up. The hand that's furthest away from the shoulder, the foot plate, you want to reach it over. And I almost think about, do you remember the singing kettle? I'm a little teapot. Almost imagine this is your sprout. I'm a little teapot, and you're pouring into a wee teacup over there. So you basically got your teapot, foot is off, and then you're then going to pour your cup of tea, take the arms over, and enjoy that absolute bliss. Come on. The arm comes up, and you lift up. How does that feel? Try the other side. So you could do loads of them. You could do ab work from there. Obviously, you'll not be going down as far. And you could counterbalance it. So generally, the top hip will generally roll back, right? Right. So, and it's usually a tightness through their hips, or they might be avoiding something their knee. So remember, you could have their leg just hanging off like that, right? There's loads of people who will be able to get into that position. This is now, where do you feel that? Give me some anatomical places. What is all that? What is happening in there, Jen? Come on. Obliques, QL. Quadratus lumborum. Yep. Yep, it's great, isn't it? So maybe a bit of TFL, even into IT band. Glute medius, min. So come off the box, right? Let's go for some supine arm work. So take your box off, put it to the side, change your springs. So depending on where you're at, spring-wise for arm work, usually in class, I would start with a yellow and a red, right? That's my kind of default, a yellow and a red, but it really is a bit of a minefield, right? You're going to have lots of people with shoulder capsulitis, elbow issues, the age of them. So you might want to just have one red or one yellow or one green even, right? But actually going lighter with osteoarthritis in her knee, and we're going to discuss how we've helped her with the aid of osteoneal injections into the knee. So hello and welcome. My name is Sarah Jane. I'm a clinical director here at the Rehab Hub, MSK podiatrist, sports therapist and PhD candidate specialising in rheumatology. So the case study that I want to talk to you about today is a client that came to see us who was a yoga teacher, who still is a yoga teacher. Her name's Emily. She's 48 years old. Quite young to be getting problems with the knees. That is quite unusual for us to see. It's usually types of patients that we see with degenerative disease at the stage that Emily's was. They're usually into their 60s and 70s. But Emily admits herself that she has just overdone some certain things, a bit like myself. I had osteoarthritis in my left hip, and subsequently had a hip replacement. So she's pushed her body, let's just say. So anyway, her right knee was why she was coming in. She had been diagnosed, not with us, she'd been elsewhere and had a diagnosis of early osteoarthritis in the right knee. Now, the main issue that Emily was having was that her work primarily is as a yoga teacher, and it was massively affecting how she was then able to work and demonstrate and basically do the things that she enjoys doing, to the extent not only just her work, but even just things she enjoys hill walking, she enjoys going out walking, and it was getting to the point where she couldn't do that either. She was medication-wise, she was on quite a lot of medication, or quite heavy medication, really, considering that it's early arthritis, naproxen, so anti-inflammatory, and she was taking the maximum amount of codeine as well a day. So not a great combination. She was really at wit's end coming in, wasn't really sure what we could do. And amongst other things, because we did do Shockwave, we have provided her with a full rehab programme, but part of her management plan was an osteoneal injection. So what this does is it helps to provide, I suppose the way to think about it, and I'm probably slung saying this, but think about it like a WD-40 going into the joints. It's not quite as simple as that, but essentially what it's doing is it's providing that lubrication in the joints. If you imagine where you've got bone degeneration and the cartilage is worn away and that's an synovial joint, then what will happen is you'll get this friction. So I've got a knee over here. So if you are getting this friction, hers was on her medial side of her knee, so the inside bit of her knee. So these two bones are rubbing together, rubbing together, rubbing together, rubbing together. Every step she's taking, everything she's doing. So she's getting this build-up of inflammation. So simply what we do is we go in with the injection of osteoneal into the joint line. Hers is the medial aspect, and most people's knee degeneration, it usually starts from the immediately inside aspect of the knee. For most, not always, but that's generally what we see in clinic. And what it does is it provides this coating, this buffer. So I'll show you, this is osteoneal here. So this one is the standard osteoneal. This particular client, I don't have any in stock just yet, this particular client got osteoneal plus, where she only needed one injection. You can do a course where you get 3 injections, it would be with this, and you would come weekly for an injection for 3 weeks, and that would be it. Now, generally, how long does it last for? You'll usually do a course of it once, possibly twice a year. That's it. So this is what the little cartridges look like. It's hyaluronic acid. So this one's out of date, so hence why I'm doing this. So you can see here, and it's just quite a sticky, viscous structure. So you can imagine that coating and lining the joint. Obviously, this one is one that it won't be getting used in a patient. It's there for demonstration purposes. So what that does is it in itself, just that being there will help reduce the need for naproxen, the need for inflammation, the need for that bone to be rubbing and causing that inflammatory process. So generally we find that patients get results quite quickly with that because it's not that rubbing, so they get a big reduction in pain immediately. But it's also helping in that synovial joint as well. So with Emily, it was her right knee. She came in, we decided with Emily that the osteoneal plus was the right course of action. I kind of alluded earlier there that sometimes people come in with this one and they get 1 injection or 3 injections. So why would we choose to do that? It depends on each individual patient. The price is much of a much. It's a full package if you're doing injection therapy. And it just depends on your particular needs. I've got a lady coming in next week and it'll be Osteoneo Plus she'll be getting as well because of her circumstances. So it's not the same for everybody. It does just depend. So osteoarthritis, she had 1 injection of Osteoneo Plus. We then followed Emily up 2 weeks after, and she had reported back that within a few hours of the injection, she said it was a wee bit sore around where the injection was, which is dead normal after that. Post-injection, you've had the injection, it just feels sensitive. If you ever had one in your arm, it just feels a wee bit sensitive. And then after that, she said it was fine, just for that kind of 24 hours, that I could just feel that something had been there. And then she said she started to feel slight improvement, almost up. It just kind of built up. By 2 weeks, she was feeling the benefits of it, but she was still kind of struggling a little bit. Then when we checked in 1 month later, Emily was like, my pain is completely gone. And what was phenomenal was that she is now off her naproxen fully. She's not having to take them at all, not even at night. She's fully off them, and she's off all pain medication now, considering she was like taking the maximum amount of codeine, that which is not great. There's so many side effects with that. It's not brilliant to be on that. She's fully off all medication. So that for her is life-changing. Now, we've not fixed Emily's knee. We're not going to fix it. It might be that down the line, Emily may need a knee replacement. And that's not for me to say. It might be a choice that she chooses to do later. She's quite young for a knee replacement at 48. But what we're doing is we're allowing Emily the ability to be able to do what she enjoys for a longer period of time and keep her on her feet, keep her active, keep her healthy, and that is life-changing. We're not fixing the osteoarthritis, we are reducing that pain and helping her manage her condition. Now, I just want to be clear as well, within this management plan for Emily, it wasn't just injection therapy, and it's really important that I get that across in this, because if I had to say that you just come in and you get an injection and that's all you would that we would do to you, really we're giving you a disservice there, because there's other things to consider around, one, why you're getting that degeneration in the first place. So with Emily, what is it she's doing in her yoga practice that's contributing to that? So actually a lot of guidance and support for her in her biomechanics and actually her movement patterns. She needed a lot of that to really, really hone in on how she's utilising her body and putting excess forces through it. So Emily needed a bit of support with that. And yoga teachers, golly, that's a bit of a sweeping statement, but just because you're a teacher, regardless of what you're teaching, doesn't mean to say that your form or your technique is perfect. So Emily needed a good bit of support with that, and that will help her as well. We also wanted to have Emily not just focusing on yoga. We really needed to get her to strengthen through her legs and her hips, because when we did her gait assessment, so she had a full assessment with her run walk 3D system, we found that Emily was from the lower limb, she had this she was in this extended pronated position through her foot, which is fine, but for her she was loading, and this was putting excess force. So if you imagine the foot's rolling in and then she's getting this extra force going into that medial aspect of the knee. And then also what she was doing, she was hyperextending through the knees. So as she was moving, we had this hyperextension primarily through the right knee. So there was a few different things here that she needed help with as well. And also when we brought it up into the thighs and the hips, there was lack of stability and strength there as well. So a full movement pattern and strength training program was also part of Emily's plan. So it wasn't just a case of you get your injection and that's it. So it's managing all of that. The other thing with Emily that we've discussed, we've not done it yet, is possibly when she's going out hill walking. So she probably won't need this for day to day, but for her, she's probably going to need a support and orthotic for her walking shoes, because of how she's moving and the forces that she's putting through her joints. It's more than likely that down the line, we're kind of looking at that just now, she despises the thought of that, But we've got to look at, right, what is it we're trying to do? We're trying to offload this knee. We're trying to buy you more time. We're trying to strengthen everything else up. And if we can do that with an orthotic, then why not look at that? It wouldn't be something she's going to need day in, day out, but certainly if she's going a big long walk, that will absolutely be something that I want to discuss with her. There's various things that we can do with that, but that's for another video. So that's Emily, 48, Austenale injection. She's got Austenale plus one's price. What's the price for an injection? So for the injection, so just the injection, it's £250. That gives you your initial consultation, your injection, your 2-week follow-up, and your month follow-up. Your follow-ups can be in person if that suits you. I've got a patient coming down from Perth next week. So for her, she's like, can I just do the consultations over the phone? That's absolutely fine. You can do it, but we like to have those check-ins, reassurance, questions. It's a vital part of that process. So that's all included in your package. So for your Austenale ones, it is £250. If you were doing the 3 injections, 1 per week, if that was where you were going, it's slightly more expensive. I don't have the price right in front of me, but it's maybe somewhere around £340 for that full package as well. And that includes your consultation, your injection each week for 3 weeks, and then all your follow-ups as well. So I hope that's been of interest. If you've got any questions on joint injections, please don't hesitate to reach out. I'll do another video on tendon injections because we do use Austenale tendon, which if many of you may know that I ruptured my Achilles tendon. I'm an absolute walking disaster when it comes to injuries. Hip replacement and Achilles tendon rupture. Oh, I like to have patient empathy, so I say. But basically, follow this because my other Achilles has been giving me a bit of jip, so I will be having some tendon, Austenale tendon injection into my left Achilles, just keeping it nice and happy because it's grumbling at the minute, and let's just say I don't want any problems. So I'll do another video on tendon injections, primarily for the Achilles tendon, not steroids. We'll go into that in the other video. This is Austenale tendon injections. Again, if you have any questions, comment on this video. Further details on our injection therapies, I've put a link with this video, so wherever you're watching this video, there'll be a link to our website. You can go and have a read, watch some of the videos, read some of the blogs. We've got a whole knowledge centre where we answer lots and lots of questions that our patients send us. So if you have any questions, do fire them over. We always do our best to answer them. Thanks for listening, and we'll maybe see you soon. back, lift it back up, right leg down, bend, bicycle, up, left leg down, bicycle, lift and up, and again, one more either side. Last time on that left side, I'm going to just get a little bit of a release through the adductors, so take an inhale, breath, exhale, and allow the legs to just open, bring the heels, the toes towards the shins, heels towards the ceiling, and then if you can, drive the toes over towards. So it's almost like lift your back up slightly and pull at the same time sides up. And you may just almost go all the way overhead and let your legs, many people find this really hard. Take your arms overhead. Now, Robert, you're obviously clearly a lot taller than me, so shuffle yourself maybe down a wee bit, so your legs, so you've got enough space for your arms to be fully extended. Just go either side of your shoulder rests. Now take an inhale breath, bring your arms forwards. As you exhale, tuck the chin to the chest, and over you go. Did we get up? Well, it's a lot easier than that last one, isn't it? Take an inhale breath, exhale, roll yourself down. So we're just doing 4 of these, that's 1. Inhale, exhale, forward, up we go, touch the toes. Inhale as we go over, exhale, articulating and rolling the spine down. Well done. Feel okay?
Yeah.
Is that 3? 4? You should have done 4.
4.5 if you don't mind.
Right, get your foam roller. So that's the spinal foam roller. So if you can take that, as soon as the lifts underneath you, forward. What's that? There's always a chance there, isn't there? Always a chance there in classes. Right, so you want to have your tailbone here, so your coccyx spine here, and your head on this. Nobody's spine is that long, right? That you can't fit on the roller. Have you just died on that, Robert? He's like, I want to say on. How did you say to the on? Give that a minute time to on this. So you sit your bum right at the end, and then you just roll yourself back. That's it. It's not very glamorous stuff. Right, let's focus on some lung work this morning, so getting the lungs, those intercostal muscles. Anybody in here that's had COVID, that's maybe experienced symptoms of long COVID, fabulous for improving and getting that lung capacity, opening up the ribs and expanding the lungs. So even just lying on this roller, you are completely just allowing the rib cage to open. What I want you to do is place your hands on your ribs, take an inhale breath as big and as deep and as wide as you can, and then exhale, just let it all go out, and as you exhale, almost think about your rib cage closing like an accordion. And again, inhale. And exhale. So just do 2 more breaths here. And well done. And hopefully we're just feeling open through the ribs, getting that deeper, wider breath, energizing and nurturing ourselves, getting that oxygen around our body. Now from here, lift your arms up. We're going to just essentially palms of the hands facing together, reach the fingertips up to the ceiling, and then draw the shoulder blades back. You're going to inhale as you reach up, exhale as you draw the shoulder blades back. Inhale as you reach up, exhale, draw back. 1 more here. Inhale, you're up, exhale, you're down. This time, inhale as you exhale, open the arms up, get that openness through the pectorals. Inhale, close the arms, exhale, open. 2 more times just like this. So we're inhaling, closing,
we're exhaling, opening, really getting deep and wide into the lungs. And again, this time on this one, stay here, stay open, then bend at the elbow. So just basically bend your elbow to 90 degrees. So you're trying to get the forearm down towards the wood of the reformer. From here, we're going to bring the palm of the hand face down, and then we're going to bring the arm back. So basically, we're just using those, we're going from internal and external rotation at the shoulder. So the actual arm doesn't really move apart from basically you're just rotating in at the joints of the shoulder. That's it. It's great for just encouraging normal motion, ability down the joint. Just do one more. And release that off, release through the shoulders. Let's go through into shoulder bridge. Bring your hands to the side of your body, legs hip width apart. Take an inhale breath, and as you exhale, tilt the pelvis into that posterior tilt, so your spine will go down to the rolling initially, and then you will then articulate your peeling each vertebrae off the roller one section at a time, squeezing through the buttocks, taking an inhale breath, and as you exhale, you reverse this. You articulate from the top of the spine to the middle of the spine to the bottom of the spine to complete the movement in a nice natural curve at the bottom. You then take an inhale breath to prepare. Exhale and articulate, peeling the vertebrae one section at a time off, driving your knees away from you as you lift. So that force is going this way. We're not just crunching up, we're basically lengthening as we go. We're taking an inhale breath at the top, exhale, bring that down. Two more just like this, just focusing on that articulation, contraction through the buttocks. Taking an inhale breath, exhale, we lift, we peel the spine. You may notice a little bit of discomfort as you go up, as long as it's not something that gives you an ouchy, making you want to come away from it. Inhale before you move and exhale as you move. And this is your final one. Inhaling before you move, exhale as you move. Again, articulating, feeling that length, openness, lifting through the hips. Get as high as your body finds comfort. Release through the neck and the shoulders, so we're not hunching up there. Then taking an inhale breath, exhale, release, and ease that down. Roll yourself off the roller and just place the roller to the side on the floor. We're going to go through to the shoulder bridge now. Take an inhale breath, exhale, articulate the spine all the way up. Now this time as we go down, we're going to roll down the right hand side of the spine. So take an inhale breath as we exhale. We just almost tilt our pelvis and try and articulate just at the erector spinae, at the side area of the right hand side. Then take an inhale breath, come back through centre. As we exhale, go up through that central point of your spine, and then we're going to go down the left hand side. So we inhale to prepare, exhale, and just bring the left side down. Notice the differences there. You really spot on your tight bits. Bring it back to centre, inhale up through the centre, exhale down the right. We'll do one more, like so, up through centre, down through left, and we're going to reverse this. We're going to go up through right, down through centre, so go up through the right side, then down your spine through the centre, and then up through the left, down through the centre, and just one more on each side, up through the right, down the centre, last time, up through the left, and down through the centre. Bring your knees into your chest, give a little hug, and always just roll if it feels comfortable to do so. Pay attention to how you, by default, what you do with your legs when you do this. Do you ordinarily toss a leg over? If you do, amuse me, toss your other leg over. So Donald, yeah? It feels different, doesn't it? Just do it. You can amuse me.
If you don't toss your leg over.
Yeah, well, you just stay where you are, that's fine. That's good. Pop your feet on, no crossing of the legs. Take your arms to the side, take an inhale breath, exhale. And just be mindful of your spine corrected in case you hit it, but take your legs to the right side. Take your head to the left side, just feel this, maybe across your pecs, maybe your back, maybe your hips, maybe even your knee. All of that is Pretty much fair game, that's okay. Take an inhale breath, come back to centre, exhale, go to the left. So the knees go to the left and the head just looks right. Just allow, whatever you feel, just acknowledge it. All is fine. Bring that back, straighten your legs out. We're going to do a roll up, just one you'll be happy to hear. Take an inhale breath, exhale, articulate the spine, roll yourself up, touch the toes. Keep 2 breaths here, really breathing into your back ribs. Inhaling, trying to get really deep into your back. And then exhale, try and sink down a bit further. And again, breathing really deep into the back, breathing in. And then breathing out. And release that up, put yourself up. We're going to get our Pilates wheel. So if you can put your foam roller just back underneath your reformer, so you don't slide on it and fall into it, or if any other accident we might decide to try and do it yourselves, then your spine your Pilates wheel normally just lifts at the top. See that? I knew it was. So that's in fact sometimes. So these normally lift, so if you're in this room, you'll have to raise that weird round thing. They always see how the top of the machine where your tower bit is. You basically just slide into the that's what they're usually kept. Right. The biggest safety thing for this is that we don't want, under any circumstances, for it to fall to the side. Right, that's really sore. It will really hurt you. Now you'll end up with a bruise. So let me show you what you're going to do. You're going to go into some side extensions. So you're bringing this in here, this is how you get into it. Lower back, hands at the side for balance, then up and over. What I do not want, watch this. Boom. That's going to be sore, right? Yeah. So I need you to be really just mindful. If when you're coming off it, you basically just bring your body forward, so that's it, don't just have your legs there, that's it. And have your hands on the mat to help balance you. And I want you to roll the length of your spine. Let your head go back if that feels comfortable. If it doesn't, you can keep it up. But actually go down the bottom of your back and then roll up to the top between your shoulder blades. Okay, try and up as well. So just simply walk your legs forwards to do that, and you start up down. And you'll feel through the hips, the front of the quads there, kind of. You can take it into full spine extensions if you feel comfortable doing that, but keep it just where you feel happy. Okay, you don't need to go wild with this. Sometimes just hanging out up near where the shoulder blades are can be nice. Just letting the knees drive forwards over the ankle. Get that nice dorsiflexion moment. Let's take an inhale breath gently as you're beginning a move, and then exhale as you kind of go into that. And it's quite, it's nice, but it's scary as well, isn't it? Now I put the fear into you, you're falling over, but I'd rather you had a wee bit of caution with this than came off the side of it. And it's really quite, it's sore, really sore. Right, just start to finish on whatever you're on, just kind of finish up on that, and we're going to, while we've got our classes here out, we're going to go into a long hip flexor stretch. Right, so Dawn, with your knees, let's see how you cope with this on your knees. I'll show you this, and if you don't wish to do this, you can simply go over to the ladder barrel and do your quadricep stretch up there. Okay, so if you're not liking that, that's where you go. Okay, give it a wee try, but if your knee's not happy with that, that's your option. Right, from here, basically we'll do our right leg, right? So you get into this position, and then you then need to get the left leg forwards and get up. Now even being in that position can be a bit challenging. And if we've got knee pathologies, if we're trying to avoid knee replacement, you've no doubt get that pain on your knee. Right? So if you're not happy with that, just use the ladder barrel to do this if you need to. Right, we're all happy? Ish. You're saying happy, there's nothing about this happy, is it? Right, Donald, you're struggling to get up because that's so tight across your thigh, isn't it? Can you get the left leg further forwards? Could you step it? What about pushing it forwards, no.
No, I'll go
Right,
with
over at the barrel, over in here. That's good, right? You know, you're
that.
a man who knows his limitations. That's a reality. That's it. So do your right leg, go on the right, so you're basically in the lateral barrel, right leg's going to go up, and you're doing all the same stuff, right? That's it. And then I would put your left foot on the ground rather than up there. That's a bit touches that. So you just listen in the exact same way, okay? Now what I want us all to do is tuck our tailbone under, and you'll feel that intensify the front of your thigh. Now, when we're on this, the right hip will have dropped down. I want us all to drive our right hip up the way. So almost imagine the right hip, or leveling the right hip to join the height of the left. Okay, and you'll feel that intensify even more. Okay, 15 to 30 seconds here is all we need. Donald, tuck your tailbone. I want you to hide your bum. Stand tall, knees together if you can. Okay, you might not be able to get them together, but you know that's your direction of travel. Right, come forward. So Donald, you just lean forwards as well, and then you just come out of that, and then we're going to change to the left leg. So Donald, do exactly the same on the lateral barrel. Essentially, foot on, shin on for us. The right leg for us comes forwards. We help it forwards. Come up. We settle in that. We assess how we feel. I rotated through our spine or pelvis and twisting round to the left side. Let's see if we can sway ourselves off. Maybe by doing that, you feel a bit like, whoa, that already pulls. Tuck your tailbone under. I'm pretty sure you're all feeling that at that point. And then drive your left hip up higher. So really think about the hip bone in front of your hip being pulled up. So use the waist. You're not side bending, you're just driving that up. 15 to 30 seconds here is where you need to be for that developmental stretch. Holding that there, breathe. Try and think of something good. We're all enjoying the football.
No, not the same.
I haven't watched anything either.
It's too much for me.
Right, come forwards. Well done. Good job. And that always can feel a wee bit precarious. That's a good. That feel okay on that. That's your good spot. Right, over you go. So that's where you go down for that. So when we're doing the knee stretches, that just will even stretch the barrel. Okay. Right. I want to use we're going to go into our 100s with we all got a circle, didn't we? We've all got circles, make sure your circle's handy for this one. So we need, these should be set up, because I taught a class last night, and nobody's been in since, so everything's set up when you need it. So you've got your small string with a triangle on, and you've got your long string with these on, right? And in terms of your eyelet, it's not massively going to make a big difference for this, but the higher for what we're doing will be more difficult, the lower is easier. You find it, or honestly, that is fine. Right, take your circle. Has anybody got their circle? Donald, have you got a circle? See that thing behind you that's black with the grey side bits? It looks like yours is grey. Go right behind you in the basket.
Oh, right, sorry.
Right, this is your glasses circle. Donald's got one as well. Right, so it looks like this. Have this handy when you need it. Right, we want to be an arm's length away from your metal bars. Okay, then from here you're going to put your circle, the padded bits always are where the force is applied. You're going to put your padded bit against the left leg and the left hand, okay, and then you're going to lift up the long strap or the long spring, put your hand in the small loop. Everybody got it? Right? Just the right one, Robert. So the long spring, and the small loop. You got it? Actually, Robert, just use your triangle. Use the triangle. Doesn't matter. It's not worth it. You got it? Yeah, that's it. That's it. You were thinking rope. Right. That's it. So it's on the spring. So left leg on left hand, right hand's got the spring. Yep. We're going to do a tabletop position. So before we do that, we need to make sure our spine is A1 in the right position. So I want you to just tilt your pelvis forwards and backwards and just acknowledge how your spine is feeling now. After all the work that we've done this morning on that, it should be feeling good. But I want you to just find a nice natural curve of your spine, and I want you to maintain that curve throughout this full move. Pelvic floor, you've got awareness there, you're aware of drawing your belly button in. Just an awareness, don't overly pull up. You're then going to float your right leg and your left leg up into what's called tabletop position. Let's have a dorsiflex ankle joint. And then you're going to drive your left arm into the left knee, and you're driving the left knee towards the left arm. Got it? Then you're going to inhale, and as you exhale, draw your right arm down on the spring, and you're going to pulse your breathing in. 2, 3, 4, 5, and out. 2, 3, 4, 5, and in. 2, 3, 4, 5, and out. 2, 3, 4, 5. Now keeping the tummy pulled in. Pay attention as you do this that your back is maintaining the position that it was in, that you're not going into this big gappy lower back, you're not loading that lower back up. So just that's where I want your focus primarily to be, on your positioning, that you're able to maintain that, the belly's not doming out, you are breathing, you're getting that lovely deep breath, you're really expanding the ribs, you're not just shallow breathing. And then release that down. Let's change it over. Right leg with a circle, left arm with a spring. You all okay? Kind of. So leg on, legs lifted, spine is in place. Take an inhale breath as you exhale, draw the left arm down, and you're breathing in. 2, 3, 4, 5, and out. 2, 3, 4, 5. Now you could pulse the circle as well if you so wish. Adds a little bit of a brain challenge. Make sure you put that dorsiflex position at the ankle joints. That means toes to shins. If you want to make it easier, you absolutely can put the left leg down on the mat. If you're finding, actually, SJ, this is just doing too much, my back's not able to maintain it, then this is where you would go. Okay? And if you're really finding, oh no, you can put both feet down, no problem. Okay? Just maybe interchange it as you feel. And then relax that down. Woo! Pop your circle to the side, everybody okay? Pop your legs into the long loops of the long springs. Hands go on to the metal, pointing through the toes. Keep the spine down and nice, and you're not hinging up, so you've not got this tilting laterally into the pelvis. So just be aware that the hips are level, and notice that if you want to just pay attention to that as you move. Take an inhale breath, and as you exhale, just circle the legs around. On the tower, you have the flexibility to be able to go as wide and as deep as you wish. So use that. 12 rotations one way, 12 the other. After we've done our circle rotations, you okay, Robert?
I know.
Oh, you're just kicking your spine corrector out the road? That's all right. I'm sure it's been kicked a few times. And just be mindful here, I'm a bit prone to this, where we can sometimes hyperextend through our knees, meaning we push our knees beyond the range of motion. So just be mindful that you're not overly pushing your knees right back. So if you've not changed direction, do so now. Just feeling control, Brenda, for your hip, that lovely mobilization, and also that control and that strength that you're building into that. And then the heels together into your frog, exhale out, inhale in, exhale out, and in, out, and in. How we doing? And release that off. Take your legs out straps. Everybody feeling okay?
Yeah.
Lift yourself up. We're going to use the push-through bar. I know you all hate this. I'd like to do the teaser. Come on. So what we do with this is we bring this bar, so this is your push-through bar, bring that all the way through.
From here, leave your safety strap on. Don't worry that your push through bar might be lower than mine. Doesn't matter. This is basically just there to stop this hitting your face. Head under here, feet on the bar, hands on the bar. What we do with this is we're just going to do 6 of these, just simply, essentially just wringing your tail out. So head in the headrest, feet on the bar, hands on the bar, and then you're inhaling, exhaling, lifting up through the upper body, then back down, and then up, then back down, exhale up, back down, up. Do one more there, up, and then from there, stay lifted, hold it up, drop your right leg down, change the left leg, right leg, left leg, hold that there, take an inhale breath, exhale, bring that down, and then all I want you to do, holding onto the metal bars this time at the side, take an inhale breath, and as you exhale, just lift your spine off, push your toes into the bar, lift your spine off, and then extend your legs up, then inhale up there, and as you exhale, articulate your spine down one breath at a time, okay? So bend your knees, inhale, exhale, lift the spine up, so drive your knees towards your head, then lift up, inhale, exhale, then articulate the spine down. Oh, so this is the shorter spine for those that just can't do it, and on the formers, feel the difference, it's lovely. Yeah?
Yeah.
Nice. Put all the major strengths in. If you need to shuffle your shoulders down, just do it. So just get yourself into position, so make sure you're not holding up the spine. So the cervical spine, I'm particularly thinking of there. Now what you could do here, bend the knees to your head, get in close, and then massage the spine down that way. So legs straight, then lift up, then bend the knees, so we're basically reversing it. Bring the spine down, push it up, lift it up. Glorious. One more. Up, up, up. And release. And well done. Just let that come down. Slide yourself forward slightly. Hands go on the bar. The arms, the legs go out straight. Take an inhale, breath, exhale. Lift yourself up. Inhale, go down. Exhale, up. Inhale, down. Exhale, up. Inhale down, let's lift the legs up with that. Inhale up. Exhale down. Inhale up. Exhale down. One more up. Hold it up. Right leg down. Left leg down. Legs to side. Tuck drop 2. Inhale. Exhale down. Do it again. Inhale up. Right leg. Left leg. Legs out. Tuck jumps. Very good. One more time. Come on. Up. Down, down, open, in, out, in, out. I feel like we should be shaking all about.
Exactly.
Oh my God. How are we doing?
This is all practicing for the hokey cokey at Christmas.
Oh, just at Christmas, yeah. It's actually, I know. It's good though. Yeah, do well with that. Yeah, that's good. Right, we're going to put your push through bar out the road. So just take it all the way back through. Safety strap on. Then goes through. Oh my goodness. So much fun. Clearly don't get out much.
What's the safety straps?
You just leave it on now. Basically, that's its resting place there, Robert.
Well, I mean, was it meant to be off?
No, it was meant to be on. I have seen, because look at mine. See how your safety, the way that mine goes, it always ends up making this a thinner. So I always have to take mine off to move it through. You don't. But yeah, good question. Right, what I want to do now is use a pull down bar for a nice big stretch. And I like to always finish the class this way. I think this is lovely. Now, do check your carabinas, okay? Don't assume that the person that's on it previously has left it safe and well. Assume it was a 4-year-old that was on it. She may well have been. Right, you just slide back and stretch it out.
She's very good at fighting. Do you know she moved all of those hand weights all by herself? Everyone. She's so proud of herself. That's why they're all in the right colours. And just bring that up. Just carefully walk yourself in. How do you feel?
Good.
Quite nice. Really good. I quite like the flow of that in terms of like start off with a low mobility work
Yeah.
and then build it up into all that way that it's actually a bit heavy, doesn't it, towards the last part. Good, well done. I am in tomorrow, so you can in tomorrow, but I'm off Thursday, so Hannah's taking this class on Thursday, so come along and enjoy it. It will be good.